Vaginismus is the involuntary tightening of the pelvic floor muscles. When we talk about the pelvic floor muscles, we are talking about the muscles around the vagina and around the waistline. So with vaginismus, with the involuntarily tightening of the pelvic floor muscles, you'll find that most people who are suffering from this condition, they have the inability to, they have difficulty in penetration, difficulty in intercourse, or even insertion of tampons. Some people even with vaginismus will present with pain. You'll find that when they are using tampons, it's painful. During the intercourse, they usually feel some pain. So how much definitely is going to affect you, if especially with people who are having their partners and you're not able to have the intercourse. This thing is going to affect you psychologically. You'll find even people having difficulty or pain while inserting the tampons. Intercourse should not be painful. You'll find that some people will have pain on deeper penetration, and that one mostly occurs with people who are suffering from endometriosis. But there are some other ladies who will also feel pain. Even on initial penetration, there's pain. Intercourse should not be painful at all. In treatment, I can say it involves a lot of things. As you've said, there's also the psychological bit. So that one we leave them to the counselors. And when we come into the physiotherapist, first of all, we have to educate the patient, self-body awareness about the pelvic floor and how it works. We also teach the patients about the relaxation, because I've said that there's involuntary tightening. So we need to teach the patient on how to relax. We have the relaxation techniques. There are exercises we give them that help them to relax. We also teach them about breathing exercise. You'll find that breathing plays a major role in pelvic floor. As we progress with the treatment, you'll find us introducing things like the vaginal exercises that help them in relaxation of the muscles. When I talk about the vaginal exercises, we have different sizes. We have from size 1 to size 6, but they have to come so that we can show them and help them how to use them, because it's a process. You'll find younger women are affected. You'll also find that there are some ladies who will suffer from vaginismus after trauma, after rape cases. They'll end up having vaginismus. You'll find that most people think about vaginismus. Okay, most people don't know that it's a condition and it's called vaginismus. You'll find that people think that it's witchcraft. They've been bewitched. You'll find some funny stories behind it, that they did something and that's why they are suffering from such conditions. What I'll advise my fellow ladies, the moment you find out that there's difficulty or failed intercourse, there's difficulty in inserting tampons, it's always right to go to your nearest health provider so that you can seek attention, so that you get examined, so that you can know what's wrong with you. Don't wait until a later stage when you're actually an adult and you don't know how to approach it. This is something that is treatable and you can get help from the medical. When we talk about the causes of vaginismus, we can say there's trauma. We have rape cases. We have childhood trauma, or the fear that is being instilled in us. You find that when people are growing up, you're told that this is bad, nobody should touch my private parts. Yes, it's true, nobody should touch your private parts. But you'll find the way some of us pass the message, it's scary. And it instills fears.